presenting a pharmacology case study alongside my team members, Wan Asma Uda, myself, Maisala Ayuni, Nyasha Slika Anis Umairah, and Siti Sabiha. We will be discussing a case scenario involving our patient, Mr. Pablo, a 65 years old male. Mr. Pablo presented with complaints of occasional chest tightness and shortness of breath on exertion along with generalized fatigue over the past few weeks. This chest discomfort is not radiating, mild to moderate in intensity, and typically occurs after walking more than 100 meters or climbing stairs. His prescribed treatment regimen include the following medication: beta blockers such as Conco 5 mg tablet contain bisoprolol fumarate, calcium channel blocker such as Nifrin SR 30 mg tablet contain nifedipine. Next, angiotensin II receptor blockers ARB such as Forza 100 over 25 tablets. Statin such as Lipitor 20 mg tablet contain atorvastatin. Lastly, antidiabetic drugs such as Tradjenta 5 mg tablet contain linagliptin, and Diamicron RR 60 mg tablet contain gliclazide. This concludes my part of the presentation. I will now pass to the next presenter. Thank you.
Now I will talk about the 6 prescribed drugs from the doctor. Let's begin discussing 2 prescribed oral medication for type 2 diabetes. First is Tradjenta 5 mg. It is taken once daily for 16 days. Its mechanism of action is by preventing the breakdown of incretin hormones, specifically GLP-1 stands for glucagon like peptide 1, and GIP stands for glucose-dependent insulinotropic polypeptide. These hormones help regulate insulin release in response to meals. The primary indication for Tradjenta is to improve glycemic control in type 2 diabetes. However, it's important to be aware of possible side effects including pancreatitis and cough. Next, the second medication is Diamicron MR 16 mg taken twice daily. Diamicron works by stimulating insulin secretion from the pancreas. Just like Tradjenta, it's used to improve glycemic control. The possible side effects include hypoglycemia, which is low blood sugar, and nausea. It's important for patients on Diamicron MR to regularly monitor their blood glucose levels, especially if they are also on other anti-diabetic medications or have irregular meals pattern. Now, let's move on to the third medication on our list, which is Lipitor 20 mg contain atorvastatin. The prescribed dosage is 1 tablet on night for 16 days. Lipitor works by inhibiting cholesterol synthesis in the liver and reducing platelet aggregation. This dual action supports overall cardiovascular health and is crucial for preventing plaque buildup in the arteries. Lipitor is commonly used to treat various cholesterol disorders, particularly in patients at risk of cardiovascular diseases. It significantly lowers LDL cholesterol levels and helps prevent conditions such as heart attack and stroke. While effective, Lipitor may cause some gastrointestinal issues such as stomach whine, indigestion, and diarrhea. Patients should be advised to report any persistent or severe symptoms.
Okay, now we move to the next medication. Nifrin SR 30 mg tablet. The generic name for this medication is nifedipine. Okay, as the instruction from the prescription provided is take 2 tablets once daily for 16 days. As the mechanism of action for this medication is lowers the blood pressure and treat the chest pain by relaxing the blood vessels. Then improve the heart oxygen delivery to prevent the ischemia. Okay, why this happen? This happen because the medication works mainly as easing the tightness of arteries rather than slowing the heart. And usually, this medication is combined with the beta blocker or S inhibitor when the extra blood pressure is needed. The indication for this medication is to help to stabilize the chronic angina pectoris. The common side effects such as peripheral edema, headache, and dizziness. Okay, for another medication is Forza 100 per 25 mg tablet. This medication did not have any generic name, and the instruction from the prescription provider is take one tablet once daily for 16 days. As the mechanism of action, this medication help to manage the high blood pressure to prevent the strokes. Also, this medication reduce the risk of stroke for the patient with the hypertension and left ventricular hypertrophy (LVH). The common side effect for this medication is choroidal effusion, acute myopia, and angle closure glaucoma. Okay, now the last medication. Okay, the last medication is Conco 5 mg tablet. This medication have a generic name, and the generic name is bisoprolol fumarate. The instruction given from the prescription provided is take one tablet once daily for 16 days. As the mechanism of action, this medication is a beta blocker that regulates heart rate and blood pressure, also causing a strain on the heart to prevent the complication, and also help to stabilize the chronic heart failure by reducing the systolic function, hypertension, and coronary heart disease. Taking this medication may cause several side effects like constipation, diarrhea, asthenia, and fatigue.
Good day everyone, now representing a related clinical issue. This highlight key medication considerations, lifestyle advice and monitoring strategies. Our patient Mr. Pablo is managing diabetes and hypertension with prescribed medication. Mr. Pablo is taking glycoside, linagliptin for diabetes. A key concern with this combination is hypoglycemia, which can lead to dizziness, sweating and confusion. He is also prescribed hydrochlorothiazide, a diuretic. While effective, it can cause electrolyte imbalance leading to dehydration or muscle weakness. Next, medication alone is not enough. Lifestyle changes significantly enhance treatment outcome. So, Mr. Pablo must have regular exercise, doing stress management, having balanced diet. Lastly, consistent health monitoring ensure treatment success. Mr. Pablo should regularly check blood glucose level, renal function, lipid profile, and blood pressure. For summary, to write up the case, Mr. Pablo is 65 years old male with type 2 diabetes, hypertension, and hyperlipidemia. His medication include antidiabetic such as linagliptin and glycoside, antihypertensive, nifedipine, losartan, and bisoprolol, and a statin, atorvastatin. The combination of linagliptin and glycoside enhance glycemic control, while 3 antihypertensive agents help maintain optimal blood pressure and reduce cardiovascular risk. Atorvastatin support lipid control and prevent atherosclerotic event. Monitoring is essential for glycemic level, blood pressure, renal function, and potential drug interaction. That's all from us. Thank you.